Top 5 medications that doctors never take, but you take without knowing. Picture this: you're sitting in your doctor's office, anxiously awaiting their advice on how to manage your chronic health condition. As they reach for their prescription pad, you can't help but wonder, is this medication truly the best solution? What if there were alternatives that could address the root cause of your problems, rather than just masking the symptoms? Today, we're pulling back the curtain on a topic that affects millions of people worldwide: long-term medication use. We'll explore 5 types of commonly prescribed medications that many doctors themselves avoid taking for extended periods. This isn't just about pills and side effects, it's about taking control of your health and making informed decisions that can dramatically improve your quality of life. Are you ready to discover what your doctor may not be telling you about these medications? 1. The painkiller predicament, NSAIDs and their hidden dangers. Let's start with a medication that's probably sitting in your medicine cabinet right now: non-steroidal anti-inflammatory drugs, or NSAIDs. These include common painkillers like ibuprofen, naproxen, and diclofenac. They're the go-to solution for everything from headaches to arthritis pain, and millions of people pop these pills without a second thought. But here's the kicker: while NSAIDs can provide quick relief, long-term use comes with a hefty price tag for your health. Think of your body as a well-working device. When you're in pain, it's like a warning light on your dashboard. NSAIDs are like putting a piece of tape over that light. The problem might seem to disappear, but the underlying issue remains unaddressed. So, what's really happening when you rely on these medications for extended periods? Let's break it down. Heart health hazards. Did you know that prolonged NSAID use can increase your risk of heart failure by a staggering 20%? That's right. The very medication you're taking for pain relief could be putting extra strain on your heart. It's like revving your car's engine constantly. Eventually, something's got to give. Gut-wrenching consequences: your digestive system takes a hit too. NSAIDs can cause ulcers and bleeding in your stomach and intestines. In severe cases, they may even lead to perforations. Imagine tiny holes developing in your gut lining. It's like constantly scrubbing a delicate surface with sandpaper. Over time, the damage adds up. Kidney complications: your kidneys constantly clean your blood of waste. Long-term NSAID use can throw a wrench in this process, potentially leading to reduced kidney function. This can manifest as fluid retention and swelling. It's as if your body's drainage system is getting clogged. But wait, there's more. Prolonged NSAID use can also lead to dizziness and headaches, ironically, the very symptoms you might be trying to treat. Allergic reactions, ranging from mild skin rashes to severe breathing difficulties. So, what's the alternative? Instead of reaching for that bottle of painkillers, consider these natural approaches. Gentle exercises like yoga or Tai Chi to improve flexibility and reduce pain. Acupuncture or massage therapy to target specific pain points. Heat or cold therapy for muscle aches and joint pain. Mindfulness meditation to change your perception of pain. Pain is often a symptom of an underlying issue. By addressing the root cause, whether it's poor posture, excess weight, or lack of movement, you are not just treating the pain, but potentially solving the problem for good. Of course, there are times when NSAIDs are necessary. If you do need to use them, follow these guidelines: stick to the lowest effective dose, take them for the least time needed, always take them with food to minimize stomach irritation, stay hydrated to support kidney function. 2. The statin situation: cholesterol control at what cost? Now, let's turn our attention to a class of medications that's become almost as common as multivitamins in many households: statins. These cholesterol-lowering drugs are often hailed as miracle workers, prescribed to millions to reduce the risk of heart disease. But as with many things in life, the truth is more complex than it first appears. Statins stop a liver enzyme from making cholesterol. It's like putting a roadblock on the highway of cholesterol production. Sounds great, right? Well, not so fast. While statins can indeed lower cholesterol levels, the benefits might not be as clear-cut as you've been led to believe. Let's crunch some numbers. Studies show that statins can reduce the risk of heart disease by 30% to 40%. Impressive until you dig a little deeper. In a large study, about 3% of people who didn't take statins had heart attacks, compared to 2% of those who did. That's a relative reduction of 30%, but in absolute terms, it's only a 1% reduction. To put it another way, to prevent one heart attack, many people need to take statins without seeing any direct benefit. It's like buying an insurance policy where only 1 in 100 policyholders ever makes a claim. But the plot thickens. Long-term statin use comes with its own set of risks. Muscle mayhem. Some statin users experience muscle pain or weakness. In severe cases, this can lead to a condition called rhabdomyolysis, where muscle fibers break down and release their contents into the bloodstream. It's like your muscles are being squeezed like a sponge, potentially damaging your kidneys in the process. Diabetes dilemma. Surprisingly, long-term statin use may increase your risk of developing type 2 diabetes by up to 50%. This fixes one issue but might cause a new one. Cognitive concerns. Some people report memory problems and difficulty concentrating while on statins. Imagine trying to recall a familiar name or navigate a once familiar route, only to find your mental map has become fuzzy. Mitochondrial mischief. Statins can interfere with the function of mitochondria, the powerhouses of your cells. This can lead to fatigue and muscle weakness. It's like your body's batteries are constantly running low. Now, don't get me wrong. For people who've already had a heart attack or are at high risk of heart disease, statins can be lifesavers. But for those with high cholesterol as their only risk factor, the picture is less clear. So, what's the alternative? Here's where it gets exciting. Changing habits can help many people control their cholesterol. Eat foods good for your heart, like fruits, veggies, whole grains, and healthy fats. Get moving with regular exercise. Even a daily walk can make a big difference. Maintain a healthy weight. Shedding excess pounds can significantly improve your cholesterol profile. Quit smoking. Your heart and the rest of your body will thank you. These changes don't just lower cholesterol, they improve your overall health, potentially reducing your risk of a whole host of chronic diseases. 3. The sleep medication maze. When counting sheep isn't enough. Picture this, it's 3 a.m., and you're wide awake, staring at the ceiling, your mind racing. Sound familiar? For millions of people, this scenario is all too common. Enter sleep medications like zolpidem, commonly known as Ambien or Stilnox. These little pills promise a quick fix for insomnia, offering the allure of a good night's sleep. But as with many quick fixes, there's more to the story than meets the eye. Sleep medications work by enhancing the effects of GABA, a neurotransmitter that helps calm brain activity. It's like hitting the brakes on your brain's racing thoughts. Sounds perfect, right? Well, not quite. While these medications can indeed help you fall asleep faster, long-term use comes with a host of potential problems. Let's pull back the covers on the risks. The dizzying downside. One of the most immediate concerns with sleep medications is the increased risk of falls, especially in older adults. Imagine waking up in the middle of the night, disoriented and unsteady. It's a recipe for potential disaster. Memory muddle. Some users report engaging in activities like driving or eating while not fully awake, with no memory of these events the next day. It's like your brain is on autopilot, potentially leading to dangerous situations. Dependence dilemma. Over time, your body can become dependent on these medications to fall asleep. It's like your natural sleep switch gets stuck in the off position, making it increasingly difficult to drift off without chemical assistance. Rebound insomnia. When you try to stop taking the medication, you might experience what's known as rebound insomnia. Your sleep problems come back, often worse than before. It's like your brain is throwing a tantrum, demanding its nightly chemical lullaby. But here's the kicker: while these medications might help you fall asleep, they can actually reduce the quality of your sleep. They often decrease the amount of time you spend in deeper, more restorative sleep stages. It's like filling up junk food. You might feel satisfied in the moment, but you're not getting the nourishment you really need. So, what's the alternative? The good news is that there are many effective, non-pharmacological approaches to improving sleep. Keep regular sleep times, including on weekends. Create a relaxing bedtime routine, maybe a warm bath or some gentle stretching. Set up your bedroom for good sleep, cool, dark, and quiet. Avoid screens before bed. Device lights can upset your sleep pattern. Use calming methods like deep breaths or slowly relaxing muscles. For many people, cognitive behavioral therapy for insomnia, CBTI, can be incredibly effective. This approach helps you identify and change thoughts and behaviors that are interfering with your sleep. It's like rewiring your brain's sleep circuits. 4. The diabetes dilemma, SGLT2 inhibitors, and the sugar struggle. Let's talk about a health condition that's reaching epidemic proportions: type 2 diabetes. If you or someone you love is dealing with this condition, you're probably familiar with the constant battle to keep blood sugar levels in check. Enter SGLT2 inhibitors, a relatively new class of diabetes medications that work in a unique way. Like all strong tools, they have their own problems. First, let's understand how these medications work. SGLT2 inhibitors target a protein in your kidneys called sodium glucose cotransporter 2. This protein is responsible for reabsorbing glucose back into your bloodstream. By blocking this protein, SGLT2 inhibitors cause excess glucose to be excreted in your urine. It's like installing a glucose drain in your body. Sounds clever, right? And indeed, these medications can be effective at lowering blood sugar levels. But here's where things get tricky. The infection connection: by increasing the amount of glucose in your urine, SGLT2 inhibitors can create a breeding ground for bacteria. This leads to an increased risk of urinary tract and genital infections, especially in women. It's like creating a sugar-rich environment that harmful bacteria love to colonize. Dehydration dangers: as these medications cause you to lose glucose through urine, they also increase fluid loss. This can lead to dehydration, weakness, and fatigue. Imagine your body as a plant that's not getting enough water. It starts to wilt. Ketoacidosis concerns: in some cases, SGLT2 inhibitors can lead to a serious condition called diabetic ketoacidosis, where your body starts breaking down fat too quickly. This can happen even when blood sugar levels aren't very high, making it particularly tricky to spot. Amputation anxieties: some studies have suggested an increased risk of lower limb amputations with certain SGLT2 inhibitors. While rare, it's a sobering reminder of the potential long-term risks associated with these medications. Now, don't get me wrong, for some people with diabetes, especially those with heart or kidney disease, SGLT2 inhibitors can be beneficial. But for many others, especially those in the early stages of type 2 diabetes, there might be better options. So, what's the alternative? Here's where it gets exciting. Many people with type 2 diabetes can effectively manage their condition through lifestyle changes. Adopt a balanced, nutrient-rich diet low in processed foods and added sugars. Engage in regular physical activity. Even a daily walk can make a big difference. Maintain a healthy weight. Losing just 5 to 10% of your body weight can significantly improve insulin sensitivity. Control stress using methods like meditation or yoga. Get adequate sleep. Poor sleep can wreak havoc on your blood sugar levels. These changes don't just help control diabetes, they improve your overall health, potentially reducing your risk of a whole host of chronic diseases. Keep in mind that handling diabetes is ongoing, not a final goal. It's about finding the right balance of treatments and lifestyle changes that work for you. As we move on to our final medication, think about this: how many other health conditions might benefit from a more holistic, lifestyle-focused approach? Get ready, because our last topic is one that affects millions of people every day, often without them even realizing it. 5. The acid reflux riddle, PPIs, and the stomach acid saga. Let's dive into a topic that might hit close to home for many of you: acid reflux. You know the feeling, that burning sensation in your chest after a meal, the discomfort that keeps you up at night. For millions of people, proton pump inhibitors, PPIs, like omeprazole have become a go-to solution. These medicines decrease stomach acid production. It's like turning down the flame on a stovetop that's boiling over. At first glance, PPIs seem like a miracle cure. They can provide quick relief from the burning pain of acid reflux and even help heal stomach ulcers. But as with many quick fixes, there's more to the story than meets the eye. Let's peel back the layers on the long-term use of PPIs. Nutrient absorption nightmares. Your stomach acid plays a crucial role in helping your body absorb certain nutrients. By dramatically reducing acid production, PPIs can interfere with this process. This can lead to deficiencies in vital nutrients like vitamin B12, magnesium, calcium, and iron. It's like trying to dissolve a vitamin tablet in water instead of the acidic environment it was designed for. It just doesn't work as well. Bone health hazards. Speaking of calcium absorption, long-term PPI use has been linked to an increased risk of osteoporosis and bone fractures. Imagine your bones slowly becoming more fragile, like a building with a weakening foundation. Infection implications. Stomach acid protects you from bad germs. By reducing this acid, PPIs can make you more susceptible to infections like pneumonia and C. difficile, a bacterium that causes severe diarrhea. It's like lowering your body's natural defenses, leaving the door open for uninvited guests. Kidney concerns. Some studies have suggested a link between long-term PPI use and an increased risk of chronic kidney disease. While more research is needed, it's a reminder that these medications can have far-reaching effects on your body. For people with severe reflux or stomach ulcers, PPIs can be a crucial part of treatment. But for many others, especially those with mild or occasional reflux, there might be better options. So, what's the alternative? Here's where it gets interesting. Many people can effectively manage their acid reflux through lifestyle changes. Elevate the head of your bed by 6 to 8 inches to prevent stomach acid from flowing back into your esophagus while you sleep. Avoid eating large meals close to bedtime. Give your body time to digest before lying down. Identify and avoid trigger foods. Common culprits include spicy foods, citrus, tomatoes, chocolate, and caffeine. Quit smoking. Nicotine can relax the lower esophageal sphincter, allowing acid to flow back up. Interestingly, studies have shown that regularly drinking water can provide temporary relief from acid reflux symptoms, similar to medication use. It's like flushing out the acid, providing a natural rinse for your esophagus. As we close, I want you to think about your own health journey. Are there areas where you might benefit from a more natural, lifestyle-focused approach? Could some of your current medications be replaced with healthier habits? Remember, taking control of your health doesn't mean rejecting modern medicine. It means being an active participant in your wellness journey. Thanks for watching. If you've enjoyed this content, please give it a thumbs up, share it with friends and family who might benefit, and don't forget to subscribe for more health insights.